right, well, let's start. It's good to see you. It's been a
Good to
while.
see you too. I know.
Dr. Maristany, will you just kind of share with everybody a little bit about you, where you are, what you do? You can even share a little bit about how we met too.
Sure. I'm an internal medicine board certified physician, trained traditionally in the internal medicine world. I was a hospital-based internal medicine physician for 10 years. I was an academic professor at Mercer University in Savannah, Georgia. So I did all the traditional academic stuff in internal medicine. And it was fascinating, it was great, but there was a missing link. We really couldn't do the best with functional or chronic diseases. So that's why there's so many terms. Anytime you hear functional, it's a wastebasket term. We just don't know how to fix it. So
Hmm.
functional dyspepsia, functional whatever, that means we can't fix it. We don't know what it means. We don't know how to fix it, which is a big issue. Like, why can't we fix all these things? We have the best technology in the world. We're pretty advanced. We're just not utilizing a lot of these technologies because they're not standard of care. So I got certified through the functional medicine department, which is vetted through the Cleveland Clinic. And what they do is they aim at using any lab necessary to get the right information to then get the right diagnosis to then able to treat someone correctly. Unfortunately, a lot of these things are not covered by insurance yet, but they are moving in this direction. So I got trained in that, and we met because I've been doing hormone replacement for years, and we just needed to get some pellets, learn how to insert pellets, and you were there to train us on the pellet insertion, which is awesome. And that's in South Carolina, and so I trained in Georgia, right outside of that area. So we were pretty like we were neighbors at one point. But that's how we met, and that's kind of a little bit about my background. And if you want to give my viewers your background, that'd be great too.
Yeah, yeah. So I met Dr. Maristany, and he is one of those people like you talk to, and you're like, "Oh, this guy's real smart." But you knew like all the, yeah, he knew a lot of like the
Depends
deep.
on the day. It depends how much coffee I've had.
Yeah, and in a lot of environmental things. So I feel like we just kind of kept in touch, and then I started sharing with him a little bit about issues with my Hashimoto's and how I couldn't get my antibodies down. I really had done all the work I knew to do, and despite that, my antibodies were upwards of over 6,000, which was pretty crazy and scary. And I felt
Wow.
every bit of that. So he tried to convince me for months to test for Lyme, and I was like, no, 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 it's not that. And then when I finally did, that's when we finally figured out a little bit about part of the reason why my antibodies were so high. So, yes, that is your forte for sure, the environmental stuff.
Yeah, so when people say I have autoimmune disease,
Mhm.
when you go to a rheumatologist, like let's say you have rheumatoid arthritis, or if you have MS, or if you have psoriasis or eczema or Crohn's or ulcerative colitis or anything, what they're gonna always do is they're gonna try to patch the symptom by lowering your immune system, right? So they're gonna give you prednisone
Correct. Mhm.
or a biological agent like Humira, and they're going to reduce the inflammation, and you're going to feel better for sure. But they're not finding the underlying cause, and that's where functional medicine goes. Well, what is the underlying cause? And then that's when you have to think, well, if your immune system is dysregulated, it's inflamed. So what might be lurking in your body that's triggering your immune system? And as you know very well, it could be food, right? So it could be dairy, it could be gluten. A lot of people, like I know a woman that had rheumatoid arthritis so bad that at the age of 18, she had her hip replaced. I mean, that's how bad it was. And in her 40s, she finally went gluten-free, dairy-free. She got off all her medications,
Yeah.
felt like $1 million. Now I'm not saying everyone is going to be like that, but for her, that was the case. And for most of my patients, if they reduce the gluten, reduce the dairy, or whatever they're allergic to, they get better. Whether it be 30% better or 80% better, they typically get better. But then what else is driving the immune dysfunction these days? Well, we know heavy metals are actually more prevalent than we think.
Mhm.
Arsenic, mercury, lead, we're seeing it everywhere. There's chronic viral pathogens like Epstein-Barr. If you Google Epstein-Barr, autoimmune disease, there's like 1,000 articles on it.
Right.
But why? And this is, I'm sure you're seeing this too, but we're seeing a massive increase in reactivation of Epstein-Barr following COVID-19
COVID. Yeah. So,
and there's a lot of data on this. COVID-19 is so strong, it cripples your immune system.
mhm.
And sure enough, all these opportunistic infections come to the surface.
Yeah.
And I don't know, I'm gonna quiz you. You probably know this, but how many viruses do you think are lurking in your body?
I don't think I know that. And I don't know that I want to. It's probably a lot.
So I had to look this up. Look this up, guys. The human virome consists of 380 trillion viruses. And we probably only know about maybe 30 or 40 of them, right? So, and the ones that we know that are definitely bad are Epstein-Barr and obviously zoster and all these things that cause cancer. But the point is, obviously HIV, hepatitis, terrible, but there's trillions.
Mhm.
And we know Epstein-Barr and lots of them are reactivated by, so who knows how many of the trillions are reactivated by COVID. And then, of course, your immune system can't handle it. And it's trying to fire, it's trying to kill an ant with a missile launcher, right? And that's what it's doing. So it's releasing so many antibodies, it's now starting to attack yourself, which is what autoimmune disease is.
Mhm.
And then you get into this, situation. So what we have seen is if you find the underlying virus or whatever it may be, and you remove it, it takes time, might take a year or longer, but then the immune system starts to cool down. So that's what segued perfectly into the conversation with you, because
Yeah.
a lot of people have heard about Lyme disease and tick-borne infections, but they don't know how common it is.
Right.
And so I think we should talk about that for a second.
Yeah.
But there's a lot of tick-borne infections. So Lyme is just one of them. There's also Bartonella, which is very common, and Babesia, which is very common. There's less common ones like anaplasmosis or Ehrlichia, but those are the most common. So Lyme, Babesia, and Bartonella, pretty common these days. And it all started, well, the pandemic of Lyme disease, what I call, started in the 80s. And we're not really sure why, but that's when it started being a problem. If you go to Martha's Vineyard or anywhere in Nantucket or New Jersey, upstate New York, everyone knows about Lyme disease. Everyone's petrified by Lyme disease. Everyone has a friend that's like, been paralyzed by Lyme disease or has MS from Lyme disease, because MS is, Lyme disease is known as a great mimicker.
Yeah.
It mimics literally hundreds of diseases. For example, I had a patient that owns a chain of car washes where I live. She's from New Jersey and she had atypical MS. She was like young, okay, like in her 40s.
Mm.
And she would go intermittently blind in her left eye, literally lose complete vision of her left eye. And I mean, it's scary as hell. So she went to Mayo Clinic. They did an MRI. They said, you have MS.
Wow.
I'm like, okay, well, she has MS. But then when I listened to her story, it was an atypical, weird version of MS, and they were just giving her like steroids and stuff when she lost her vision. I'm thinking like this is not the cause. Like, what's the cause? So we ran because she's from New Jersey. I ran a tick panel. Sure enough, she had Lyme disease. I then sent her to a Lyme expert, infectious disease doctor. We treated her, and her MS is gone, and her optic neuritis and vision issues were
Wild.
gone.
Hmm.
And so that was one of the first times, this is years ago, that I realized, oh my God, we're not being told the whole truth.
Right.
Like a lot of these autoimmune diseases may be driven by Lyme and co-infections, and this was not standard care at Mayo Clinic. So I wanted the audience to hear your story because your story is fascinating.
Yeah, and you brought up some good points because I had done everything. Like I've been gluten free for 15 years because of my colitis. I treated, H. pylori, all the gut stuff. I had all fillings in my mouth removed. Like I live a super clean lifestyle. Had treated my hormones too. I had treated mold exposure as well. So I really at that point was just like, I don't know what else it could be. And it was really after my mother, when she went paralyzed from neck down from what turned out to be Lyme disease, that I was really like kind of scared. And I was like, I don't want that to be my story one day. And it very well could. So I was convinced I did not have Lyme disease. And so when we
Oh,
tested,
I remember.
yeah, he was, yeah. Thank you for pushing me because I'm pretty stubborn,
Well,
but
most people don't want to spend money on a test. It
correct.
wasn't cheap. And I think after like we tried everything.
We did, yeah.
Your antibodies were like, just so the audience understands, like most people have thyroid antibodies, they're like in the hundreds, like 300, 500, 600.
Mhm.
If you're in the thousands, that's concerning. If you're 6,000, that's very concerning.
Yeah,
And if you can see, she's very healthy. So I'm like, what are we doing wrong here? She's eating everything right. She literally checked every single box except for that expensive Lyme test. And that's why I was like, all right, you know what?
yeah.
Let's just let's just do
And
it.
I was scared. I was like, oh my God, do I have a tumor? So I got a thyroid ultrasound, which really didn't look bad. So I think the biggest things for me is like I felt decent, but then I would have days where I all of a sudden it was just like 2 o'clock and I felt like I had the flu, like a fever. I needed to lay down and I would like need to lay down for the rest of the day, which isn't conducive when you own a business too. But interesting, and I would love to talk about this too, is I had really was struggling with depression and really bad anxiety. And you later told me that was common with Bartonella. So I thought
Super
that was
common.
interesting. And then I have this weird symptom, which is hard to explain. And how I explain it to my patients is almost like you're like, when you're trying to take a deep breath, you can't, it's like you can't get to the top of it. So imagine like if you had to yawn and it never came, like super unsatisfying, like you could never get a satisfying breath. So I struggled with that for a year and a half of
Yep, I remember. And so air hunger. So this is another thing that. So one of my friends is a Lyme specialist. Her name is Dr. Ebony Cornish. She works at the Amen Clinic,
mhm.
and she's Ivy League trained. She's very smart. And I remember her telling me this. But basically, a lot of people, like more people than you think, have been exposed. I mean, every time you go hiking, okay, deer ticks are almost everywhere. They're really small. Some of them are nymphs. You'll never see them. The big ones you'll see. You can pick them off your body. The small ones you're never going to see. They're very, very little. And if they're pretty much everywhere, and Lyme disease used to be in the Northeast, now it's everywhere.
Yep.
There's even Japanese strains coming, Borrelia myomoto. So those are from Japan. They're everywhere. So if you're going in any forest in the United States for an extended period of time, you're probably going to get exposed to a tick at one point. At most forests, I think they did a study, like 1 out of 4 ticks have Lyme. So basically, if you go to the forest, I don't know, 10 or 20 times in your life, likelihood is you're probably going to get Lyme disease exposure.
Right.
And what happens is your body suppresses it. You have a strong immune system, right? So it kind of battles it and it puts it like in the jail. It is typically, it's actually a bacteria. And so, like I said earlier, we have 380 trillion viruses in our body that are being put in jail cells so they can't affect us, most of them. We also have about 180 trillion bacteria, including Lyme bacteria, that are being held dormant. But when you get something like COVID in the pandemic, all of a sudden you get this mass reactivation of Lyme, Babesia, Epstein-Barr. And that's what I think happened with you because
Yeah.
when you told me you couldn't catch your breath, I'm thinking I had an NFL athlete, an NFL pro football player once. This guy was like the pinnacle of health, like 5% body fat. The guy looked like a Greek god, but yet he couldn't run, and he was young, he was in his 20s, but he couldn't run more than I think it was a mile because he got so short of breath. He went to cardiologists, went to lung doctors. They all said you're normal,
Right.
but he wasn't. And I said this has to be his tick-borne infection. So there's 2 tick-borne infections that cause you to be short of breath. One of them is Babesia, which is the most common for air hunger, and the second is Bartonella. The reason is because Babesia, which is malaria's cousin, can be an intracellular, specifically in the red blood cell parasite, essentially. So it actually steals oxygen from your red blood cells. So it
Okay.
kind of makes sense that Bartonella also can live in your. So if these organisms are living in your red blood cells, yeah, they're going to make you short of breath.
Mm-hmm.
Yeah. So I think that's what was happening.
Yeah.
And
It's
so I kept convincing Aaron, I was like, Aaron, I'm pretty sure, I don't want to say it, but I'm 80% sure you have this. And she was like, no, it can't be. I'm like, I agree, but you
yeah.
are from South Carolina. You have woods around your office. I mean, you never know. There's deers everywhere. And wasn't it shocking when you got the results?
Yeah. No, I was actually really surprised, but almost like I was almost relieved too because it was so frustrating and I was just so sick of I mean I had done so many protocols. I was so sick of it, like taking so many supplements and I was just like tired of not getting resolution. So I think I'd also like I'd love to share when I initially started the protocol how I felt too because what
Yeah.
was interesting to me is you had said the second week I would feel the worst and it was actually the first week when we started, I think the minocycline, that I had such a bad die-off reaction. Like I was like, oh shit, I don't think I'm gonna be able to get through this. Like I felt so terrible. And then by the second week, I started feeling better already, actually. So it's
So
a
that's great. So explain to people what that is, what a die-off reaction is,
yep,
and because there are different antibiotics for different organisms.
yep,
So I think we were treating you for Lyme, and we were also treating you for Bartonella. There are two different groups of antibiotics involved.
yep,
And so you're saying that the minocycline, which is mostly for Lyme,
yeah,
was what really caused a die-off. So
yeah.
can you explain what die-off reaction is?
Yeah, so we call it like a Herx reaction for short, but it's when these bugs die and they create toxins, right? And they kind of release it into your system. Similar to like if you did a gut protocol too, a lot of patients experience that as well, but it's like a flood of these toxins that the bugs or whatever release, and it can feel really bad. And a lot of people won't stick through the protocol because they feel worse at
And
first.
that's the interesting point. So let's talk about that for a second. So think about this, right? Think about you have all these organisms that are like hiding in your body,
Mhm.
and then you just kill them
Yeah.
in mass quantity with an antibiotic. Two things happen. Yeah, they release toxins, which are really crazy. But two, your own body can't tell the difference between a dead or living organism. It just sees all this organism antigen in your bloodstream, thinks it's alive, and
Mhm.
sets off the alarm. So your own body, you can have night sweats, fevers,
Yes, that's
brain
one.
fog, insomnia. Did you have insomnia too?
Oh yeah, really
Yeah,
bad
sleep like
insomnia.
crap. That's why people can't. I mean, imagine if I told you for 1 week, you're gonna feel like garbage. Like
Yeah.
you're not gonna be able to exercise. You're gonna want to shoot everyone. You're gonna be moody. You're gonna be exhausted. But at the end of that, you're gonna feel amazing.
Yeah. Yeah.
Can you hold on?
Yeah.
And that's where we have to. Sometimes there's protocols where if you really can't stand it, some of the doctors will put you on like 3 times a week or like
Yeah.
twice a week and just take a little bit longer.
I just went
Um,
all in.
yeah. But if you can get it all in, as long as you can take like a couple days off work, a week off work, I think it's worth it. You still work though.
I still worked. Yeah. I didn't take any
That's
time
crazy.
off, which was really challenging. And it was
Yeah.
interesting that you said that about working out because I love to work out. I usually work out almost every day. And I didn't work out for almost 3 months. I just like, I didn't, the thought
Yeah.
of it was like just no interest.
Nauseating.
Mhm. Yeah.
Did you have GI issues like nausea and all that stuff?
I had a ton of nausea.
Yeah.
At first, so interesting. At first, I felt like I just wasn't interested in eating at all, like couldn't eat. As the second and third week, I couldn't satiate myself. Like I was so hungry. Like I
Wow.
couldn't get full. So I think like my body needed all that like protein to heal. So yeah. And I've been blessed. I've never really had issues until perimenopause with like gaining weight. So that was never like my issue, but I was super inflamed. So I was holding like, I would say 5 to 8 pounds of inflammation in my stomach. That
Wow.
that went away too after the protocol. So that was really interesting. Even like
It's
my face, I saw my face change too because I was so
yeah.
the Hashimoto's. I was so like inflamed. Hmm.
That's interesting you said because I noticed it looks like you've lost weight, but maybe it's like just
Yep.
inflammation.
I think
But you've always been thin, but it looks like you're thinner. But it's weird. It's weird because like a lot of people told me this too. Like a lot of people that have really bad food sensitivity, like they bloat to everything.
yep.
They eat gluten, they bloat. They eat dairy, they bloat. They can't eat anything. They feel like they hate their lives. They have small SIBO, small intestinal bacterial overgrowth, or CFO, small intestinal fungal overgrowth. They're miserable. If you treat them for this, it gets better. And
Hmm.
that just makes you realize, oh my God, Lyme disease could be in the gut, but
Yeah.
Babesia Barnella can be in the gut. And which gets a whole other conversation about long COVID. We'll talk about that for
Yeah.
3 seconds.
Yeah.
But I didn't realize this till one of my friends told me. So I happen to have a friend who was working at MIT who ran MIT, really ran a big part of it for 30 years.
Hmm.
And he's on the board of like everything, on every company, NSA. He's been experienced everything. And he was on the task force for COVID. And back when COVID first started, all I'm going to say is there was a very high suspicion that it was a biological weapon.
Hmm.
And because it was tweaked, it wasn't regular coronavirus. And they knew it could stay in the body for a longer period of time. So regular coronavirus, in and out, maybe in a month.
Right.
University of California, San Francisco just published last year, it's a preprint article, you can look it up, that they have found active RNA for COVID in multiple tissues in the body for up to 2.5 years after infection, which is really crazy.
Wow. Yeah.
So we're not talking about post-COVID syndrome now. We're talking about post-COVID active infection. And one of the places where it was staying was the gut and the heart and the lungs and the brain. I'm like, oh my God, basically everywhere.
Yeah.
And so, and people that, for example, they've had COVID for like a year and they still can't taste or smell.
Yeah.
It's because it's staying in the nasopharynx for up to 2 years as well. So we got to really be aware that if you have a virus that can reactivate viruses and Lyme potentially, and it can stay in your body for 2.5 years,
Hmm.
people are going to be sick. This is why a lot of people now, I think, are getting sick. They're getting autoimmune disease, they're getting cancers because viruses are firing up all over the place. So I think we all have to be very aware of what we can do to be smart about this. And I think there are some societies that are getting very creative, although it's not standard of care. The FLCCC has some very interesting chronic long COVID protocols.
Yeah.
Again, not standard of care, but they seem to be working. And I think you have experience with one of them because they helped you with chronic Bartonella. So I guess you can tell your story, but like basically I treated you. I think you told me that you went through kind of hell, but afterwards your energy was way better. Your fatigue in the afternoons was gone. Your brain fog was gone. You
Hmm.
were just feeling better. You're sleeping better,
Yeah.
but your hunger was ongoing.
Yeah. Yep.
And then,
The air hunger.
yeah. After the air hunger, we did
We
a
did.
lot.
So it got better, right?
Okay.
But then I was like, it's still kind of resolving. You're like, I think that you have some long COVID. And so we
Okay.
started the ivermectin.
Yeah. So we did a low dose ivermectin protocol for like a month,
Yep.
a low dose every day, and then we did low dose methylene blue.
Methylene blue too. Yep.
Yeah, methylene blue is very interesting. So in traditional medicine, methylene blue is being used for cyanide poisoning and for carbon monoxide poisoning,
Yep.
but it's been an antibiotic antimicrobial since 1800s. It's been used
Yep.
for the Navy used to take it to prevent malaria. So there
Yep.
was a saying that the Navy would pee blue in the loo back in 1800s. So imagine all the Navy, like
Yep.
thousands of people just peeing blue
Yes,
because
because
they
it
were
makes you
popping methylene. Yeah, it's insane. And so what we do now is we check the patients, make sure they don't have G6PD deficiency. We're careful about it. We give them very low dose methylene blue. It doesn't have to be monitored. Make sure it doesn't interfere with medications, of course. And then, sure enough, you take this 30, 45 days, and all these viral counts come down. I've seen Epstein-Barr titers come down. I've seen all sorts of stuff. And but that's when is that when it started getting better, your air hunger,
Yeah.
or when it really got better?
Definitely. Like I noticed a big improvement and I had stopped it for like a week or so when I was on vacation and I noticed like slightly it coming back and I was like, "Oh wow, I think I need to, continue it longer term." So, is that because the different bugs for Lyme cause like kind of trigger that malarial and ivermectin can be used for that? Is that why it helps? Like why does it help with that so much with the air
Yeah,
hunger?
so you know, ivermectin definitely has properties that kill Lyme and co-infections like Babesia Bartonella,
Okay.
but ivermectin also has a lot of anti-COVID properties.
Hmm.
So we don't know if it's a chicken or the egg. We don't know if it's killing COVID and then that's reducing the Lyme,
Yeah.
or it's killing Lyme and that's reducing the overall symptoms. We're not sure. We
Yeah.
think it might do both. But and again, the data's limited on this, but it works as in your case. So
It
and
works.
I just remember the call. I remember the text when you were like, "Oh my God, my antibodies are 180 or something. It used to be
149.
140, and it used to be 6,000. That's insane. I mean, this is the first time in how many years would you say?
The first time they've been under 1,000 in 4 years, under 6,000. So they were 4,000 3 years ago when I got exposed to mold, and then they've been 6,000 for 2 years. I couldn't get them down. So, yeah.
That's insane. So if you think about that, right? So pre-COVID, they were 4,000,
Yep.
and post-COVID, they went up to six.
Yep.
So that's what I'm thinking. I'm blaming COVID for some of this.
No, I
And
100% agree. Yeah.
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 And did you have any known tick exposures, like any obvious, like, oh yeah, I definitely got a tick bite, or I removed a tick from me, or
I grew up in Rhode Island and we grew up camping. So I'm sure, for sure,
yeah,
my dog always carried rot ticks in.
yeah,
Same thing with my mother, and they never thought to test her. I begged them to test her and they wouldn't. But yeah, we're New Englanders, so we were always
it's
exposed.
just exactly, it's just shocking the all the stuff that we're seeing. But I'm really glad you were able to like, experience that improvement
Yeah.
and in clinically and laboratory wise. And then we'll continue to see this improvement, I'm sure, over time. And but I'm really glad you're able to share the story because there's so many people out there that have autoimmune disease and they have no idea why.
Right.
And it's like there are causes. You just have to look a little deeper. That's
Mhm.
why I love and I'm passionate about functional medicine because I'd be able to help people like what we just did with you is it's a miracle, right? That's like considered a miracle.
Yeah.
What we did with my patient that was that had MS. That's a miracle. And
Absolutely.
you
Yeah.
know, and by the way, I have another patient, a male, who had MS, which is a little bit rare. He was only in his 50s, another atypical case. And his was also, it was a combination. He had certain toxins that were not good. He had parabens, he had phthalates, he had BPAs, he had glyphosate, he had pesticides. We detoxed all that stuff out of his system. His heavy metals were actually okay, but that was the worst part. He did have a little too much mercury. We got that down. We cleaned up his diet.
Mm.
He had a little bit of mold, and he did have tick-borne illnesses. But
Okay.
because I hit them all at the same time, I don't know which one was the main one. Like you actually did them one at a time, so
Yeah.
it was really clear. Like it was definitely a line, you know. But it's just good to be able to see that and have that recipe. And of course, it's not going to work for everyone, but I
Yeah.
mean, if you give enough effort and time into this, I feel like it should work for most people.
Yes.
Uh, and I think one day it will be standard of care. But I'm just glad that there's people that like you and me that know this. I mean, because you're polished, functional medicine expert essentially,
Yeah.
and you just were missing that one little part,
Yeah.
And so that's why you want to make sure it's very thorough,
Yeah. And it's super frustrating when you help people all day and they're like, I feel amazing. And you're like, I feel like shit. But I think one of the most
Yeah.
interesting things and important things for people to know too is like, this is, this process was over like many years of me like eliminating all enamel in my mouth, like cleaning up my diet, like managing stress better, like all those things are like, I constantly work on that every day. And that it wasn't overnight, right? And I just kept chipping away, and then me and you kept plugging away. And we
Yeah.
still are. And so it's
Yeah.
not like, I think it's important people know like it's not overnight, but like if
Right.
you're having these symptoms, it can lead to really serious issues. So it's like it's worth spending the money for the more expensive tests to get the information and treat it as soon as you
Yeah.
can.
Yeah, I want to say a test for like $1,200. I mean, it wasn't cheaper,
Yeah.
maybe more. But at the end of the day, if you've done everything else and there's a high index of suspicion,
Yep.
like you just gotta know.
Yeah.
Uh, but again, let a doctor guide you because I do all the cheaper tests first. I save that one till the end
Yeah.
because you can knock them out a lot of disease without that.
Yep.
But yeah, it's more common, and now with the pandemic and everything, you gotta keep your head up. You gotta watch out.
Yeah.
But
Absolutely.
but I'm glad we were able to discuss this. I think it's going to really help a lot of people just get an idea of what's going on. And my a lot of my patients are excited to hear this. They're going to be really excited to hear this. So thank you so much for sharing this. And
Well,
I will keep working with you and hormones and because we all need to learn. And you're an expert at hormones, which is great. I try to surround myself with people that are smarter than me. That's why like my Lyme doctors were teaching me about Lyme because I had no idea about this years ago. And I'm still learning. There's just so much information.
yeah.
But people like, Richard Horowitz, those guys are like the Lyme experts. He wrote the book, Why Can't I Get Better? It's like an 800-page book because his
Wow.
wife had Lyme disease. This is a kind of funny story. His wife had Lyme disease. She wasn't getting better with traditional treatment. So he literally looked at all the research and created his own protocols because he was in upstate New York. He
Yep.
had so many patients with Lyme disease. He had to create entirely new protocols with like longer rounds of antibiotics and oral antibiotics and et cetera. And then the Department of Health in New York actually investigated him
Wow.
and won the trial. He won it because he presented all the information and said, look, this is what's happening. We have to evolve as physicians and we have to treat better. And
Yeah.
so if you ever want to read a fascinating book about Lyme disease, again, Rich Horowitz called Why Can't I Get Better is a long read. I
Yeah.
warn you, but it's a lot of information.
Yeah. That's great information.
Yep.
And I think the more people can educate themselves, the better. So thank you for
Yeah.
healing me and fixing me.
Thank you. I appreciate it. Yeah, I'm just happy you're feeling good. You look great. If you're feeling better, that's fantastic.
Yeah.
We'll keep it going and keep us living to 120 or 130.
Yeah. That's the goal. As long as we're happy, then we're good.
Happy and healthy for sure.
Well, thanks, Dr. Maristany. I know you're busy, but I appreciate you.
No, likewise. I know you're busy too. Thank you so much.
All right.